Good afternoon. My name is David Pollock, a former chair of the Canadian Association for the Club of Rome, and it's both my duty and pleasure today to introduce our guest speaker, Dr. David Longworth. Dr. David Longworth did his doctorate degree in economics from MIT and ended his career as a deputy governor of the Bank of Canada. One of five deputies, and then the governor himself formed the senior management team where David had responsibilities with one other for making the proposals to help ensure financial stability. And so today he's going to look at a work that he co-authored with Frank Milne. Now, Frank Milne is a specialist in risk management, having degrees in economics and finance. And the subtitle of the book that they've produced, Preparing for Pandemics, is called Lessons from the Global Financial Crisis and COVID 2019. So I'm very much looking forward to seeing what those parallels are and similarities and learning from David as he presents this afternoon. So David, I'll turn it over to you and we'll have your presentation for about 40 minutes and then questions and comments from anyone on board on the Zoom meeting. David?
Thank you very much, David, for that introduction. So the title of my presentation today is essentially very similar to the title of the book that I wrote with Frank Milne. And as David pointed out, I will be drawing parallels with the global financial crisis. As you recall, COVID-19 began in late 2019. And by March 2020, it was clear that there was a major pandemic. And that was when lockdowns began in Canada. Within 3 months, it became clear that governments and public health authorities, both in Canada and elsewhere, were very ill prepared for many elements of the pandemic, and that they had not followed the advice that had come out of early pandemics and reports on those pandemics. My colleague at the Queen's Economics Departments, Frank Milne, and I were starting to note the broad similarities with the ill preparation before the global financial crisis. We had both been very involved in aspects of the global financial crisis, because at that moment of the crisis, Frank Milne was a special advisor to the Bank of Canada. And as was mentioned by David Pollock, I was one of the deputy governors in the financial stability area. And in particular, I was the one who went to meetings in Basel at the Bank for International Settlements, for meetings of the Committee on the Global Financial System, which discussed both things going into the global financial crisis, things about the crisis as it evolved, and then started to do the post-mortem and think about where we needed to go in terms of financial regulation afterwards. So Frank and I aren't health professionals, nor are we health economists, but we're very much economists interested in risk management and better public policy. We put out a number of working papers about the pandemic, and then we combined them into this book that David Pollock has already alluded to. So today I'm going to talk about 3 elements of our analysis. The first is poor preparation for the pandemics and parallels with the global financial crisis, or GFC. The second is the need for appropriate postmortems and planning with emphasis on the governance of this process. And finally, the processes that are needed to test the plans that are put together in step 2. So in essence, we want to reduce the probability that pandemics get out of hand in terms of deaths, morbidity, and other costs. And we argue for taking into account the interactions between health, economic, social, and governance aspects of pandemics. Our analysis is applicable to other areas because of the importance of sustainability, governance, and legitimacy, and because of the importance of testing plans, and because many of the areas that the information here could be transferred to are also areas where there are low probability, high impact events, high cost events. So to start with the first part of the analysis on poor preparations and the parallels with the global financial crisis, I would argue that weaknesses in pandemic preparation likely increased its health, economic, and social costs. And indeed, Frank and I have found at least 10 categories of weaknesses where there are strong parallels with poor preparations of financial regulators and financial institutions prior to the global financial crisis. So this slide talks about the first 5 of those. First of all, the plans for buffer stocks of things like buildings and equipment were either not made nor were they implemented. Also, plans for adequate number of staff were similarly not appropriately made or implemented. And the parallel with the global financial crisis here is that the buffer stock of bank equity capital was not sufficient for the kind of shock that the crisis was. The second parallel area, there were unclear public health expectations for what were to be done by firms in the non-healthcare sector. So large firms were not, it wasn't suggested to them that they have masks on hand or that long-term care facilities, for example, have adequate levels of personal protective equipment. So the parallel with the global financial crisis is here that there was a lack of appreciation of effects on less regulated entities. Everything had been done in terms of getting organized about what banks should do and what other financial institutions should do. But there were some of the financial institutions that were much less regulated than the banks, and really there had been a lack of appreciation about how they could be part of the transmission mechanism. The third similarity is that there were unclear roles of last resort making available of equipment on one hand and loans on the other. So in terms of the pandemic, we had stockpiling at the federal level of some masks and other personal protective equipment, but it was unclear about whether they were going to make that available to the provinces, whether they were keeping on hand adequate amounts. In terms of the global financial crisis, there was a question of who was going to be eligible for lender of last resort loans from central banks and what the amounts that could be made available. The fourth area of parallels is the cross-border issues. So there was an insufficient advanced discussion of the policy tools regarding cross-border travel in the case of the pandemic, and the possible financial contagion across borders in the context of the global financial crisis. In both cases, there was insufficient consideration of operational risks. So what were the operational risks that were faced in the pandemic? There were people with multiple jobs. So healthcare workers that went from one kind of hospital to another. There were people who were personal support workers who worked at 2 or 3 different complexes, and they carried the disease from one place to another with them. Another operational risk was that there wasn't the excess capacity in laboratories to be able to deal with all the tests that needed to be done to find out who indeed had COVID. There were operational risks in the global financial crisis too, in terms of weak corporate culture, weak governance that didn't put enough emphasis on following both the regulations and the spirit of the regulations that needed to be in place for banks and certain other financial institutions. So there were 5 other areas of poor preparations in these 2 events where there were clear parallels. There was insufficient consideration of data needs, data collection, organization of data so that it would be comparable to those across provinces and across countries, and appropriate dissemination of data so it could be used for research very, very rapidly. And so all those things were true for both the pandemic and for the global financial crisis. There was insufficient consideration of systemic effects of the 2 types of crises. There was particularly of the effects that lockdowns were going to have on health. And that's in the case of pandemics, and the systemic effects of the global financial crisis on real economic output and the feedback loops that that would lead to in terms of what would happen to the financial institutions. In both cases, a lot of the thinking was based on homogeneity, that everybody is the same and that we don't have to distinguish between types of workplaces, various groups, types of lenders, types of borrowers. But in reality, that realizing the heterogeneity of the effects on various workplaces, on various groups, on various types of lenders, on various types of borrowers was really important in understanding what was going on in both these cases and in modeling that. Another area of similarity was that advanced warning systems were really not up to the task. In the case of the pandemic, the Canadian government had allowed the network that they had set up many years earlier to track what was going on with things that might be indicative that there was a pandemic starting. That network had been allowed to fold in May of 2019. And so it wasn't around in the fall and latter part of that year to note that something funny was going on in China, and maybe one needed to be better prepared for something worse to happen. In the case of the global financial crisis, there were just starting to be mathematical models based on credit growth, based on debt service to income ratios that seemed to have some promise in predicting crises. But they really weren't ready. They weren't up to the task of delivering to any degree of confidence that there might be a problem occurring. And finally, and we'll get back to this a number of times in the presentation, the plans were not tested in advance. And without testing the plans, you don't know about their weaknesses. You don't know how to make the plans even better before a pandemic starts or before a financial crisis happens. So thus far, I've talked about poor preparations on the part of health authorities. But there were also shortcomings in government preparations for pandemics. There was poor oversight and implementation within budgets of pandemic plans by governments. So governments are ultimately responsible for their health authorities, and they really need to be doing something to make sure that the health authorities are doing what they're supposed to do. There was poor preparation for lockdown design. So governments had not considered before the fact how lockdowns might be implemented. And they didn't take into account the way that there are supply chains. So you need to look at both directions from the production of a product to understand what lockdowns will do. Will there be insufficient supply of inputs? And if outputs are not allowed, does that have a spillover effect into other industries that are ready to use the outputs as inputs into their processes? There was a lack of preparation for the design of relevant fiscal policies, including things like income support for individuals, protection of jobs, other subsidies to businesses, as well as loans to businesses. There was also a lack of preparation in considering those groups who might be hit disproportionately. So families headed by single people, the poor, Blacks, Indigenous, people of color, and healthcare workers. So let's go on to the second part of our analysis, which has to do with postmortems and planning. So postmortems at many levels still haven't been done, and it's time to do them now. The Globe and Mail pointed out in an editorial in early May that we haven't had a national inquiry yet. There's a lot of things we don't know. Because we haven't looked at it thoroughly, we're probably not well prepared for the future. Planning for future pandemics needs to include cost-benefit analysis of different options to improve the situation. It also needs to look at catastrophe risk insurance. And finally, there needs to be an emphasis on governance. One needs to look at evaluation and accountability, and one needs to look carefully at the roles of certain government agencies, which might be given more independence. One needs to look at the role of the legislature and legislative committees. So as the pandemic changes, as it winds down in terms of its worst periods, at regional, provincial, and national levels, one needs to examine whether pre-existing plans for the preparation had indeed been carried out, whether other plans should have been made in advance, whether existing plans were carried out in a timely manner, what was learned over the course of the pandemic that belongs in future plans, and where insufficient planning and decision-making was undertaken between the waves, and what that says about processes that need to be followed in subsequent pandemics. It's important that those doing these postmortems have independence and experience. You need the right kind of experts. And you need to consult with those known to think outside the box. So you don't want to just look at solutions that have already been used either domestically or in other countries. You need to think about new ways that maybe things can be made better. And the topics that are discussed in postmortems need to include all the 10 areas that I discussed in the 2 slides on part 1. Now turning from postmortems to plans, the plans need to cover 2 things: pre-pandemic steps and plans for actions during the pandemic itself. In the pre-pandemic steps, among other things, the plans need to keep track of stocks, of things like personal protective equipment and other equipment, the amount of excess hospital space, the amount of excess lab space, and they need to put into place and test data systems. Plans for actions need to cover all the various topics that I discussed in part 1. In the economic policy area, policy options for income transfers, for wage subsidies, for subsidies to firms and loans to firms will need to be set out and examined. They need to use cost-benefit analysis, looking at the options, and suggest the best and the second best options to be used. All plans need to be shared across all levels of government, so nothing falls between the cracks. I'd like to turn now to catastrophe risk insurance. Two major areas of national unpreparedness for economic effects were first that the insurance industry doesn't have the capacity to provide enough property casualty coverage for things like pandemics, and governments have not prepared a plan to contain catastrophe impacts. My co-author, Frank Milne, and a good friend of his, John Crean, argue that the most effective solution would be to draw on the insurance industry in the property casualty area, but legislate government insurance backdrops as exist for terrorism and nuclear accidents. This would allow firms to get insurance and for the private insurance firms to offer it to them because they know that there's a backstop from the government. This will mean then that there aren't big hits to the capital of firms that want to be insured. And because there are not big hits, then the government doesn't have to directly support the firms in ways other than providing these insurance backdrops. Because firms will be able to obtain this insurance, banks will require the firms be insured in order to give them loans. This means then that banks themselves are not suffering risks from this kind of catastrophe, and therefore they won't reduce their downturn. They won't reduce loans in the lending. It will not be like the downturn that usually happens when things go bad in a particular area for the banks. Because the banks will continue to make loans, therefore there won't be this need for much government administrated or many government administered loans, and that kind of solves that problem. So the whole process is simplified. We need less government support of firms, and we need less government administered loans during pandemics. In his 2021 book, Mark Carney lists 3 behavioral reasons for government inaction that are important when we look at the whole question of governance, evaluation, and accountability. These 3 behavioral reasons come out of behavioral economics and behavioral psychology. And they are recency bias, which means that people forget about the historical record and just remember what's happened in the past few years. Disaster myopia, where people underestimate the probabilities that disasters can happen. And hyperbolic discounting, where people discount too much the future benefits of actions, and they're put much more emphasis on the present. So this is called a present bias as well. Now we seek to look for governance models that minimize chance of time inconsistent behavior. And there's a parallel here for with independent central banks. So time inconsistent behavior is one where One sets out in advance the way one is going to behave, the plans and processes and rules and regulations. But when something bad happens, you throw part of that out and you act in a different way. Paul Tucker, a former deputy governor of the Bank of England, published a book in 2018 called Unelected Power, where he looks at under what conditions independent agencies could credibly commit to sticking to a legislation and plan and would be seen as having political legitimacy so that they could actually be created with some independence. I think there are 4 areas for independent agencies to provide unbiased views and or make credible commitments in the pandemic area. The first is by carrying out postmortems and creating plans for pandemic preparations. The second is implementing the parts of the plan that doesn't involve huge expenditures, like for capital. Third is designing and reporting on stress tests and exercises that I'll be discussing more in part 3. And finally, evaluating whether the plan has indeed been put into place and is being updated regularly. Now, likely the first 3 of these areas could be carried out by one agency, and the evaluation could be carried out by another agency. So let's turn to these 2 types of agencies in turn. First, the agency for planning, updating, and more. Many public health agencies, or PHAs, are responsible for infectious diseases and emergency preparedness and response already. They're typically responsible for having a pandemic plan, for updating that plan, in principle for testing that plan, and for implementing many parts of it. Now, for Mark Carney's 3 reasons, it's useful for them to have some independence. They probably couldn't be fully independent because some implementation needs to be done elsewhere, so some of the government policies, for example, and obviously there are different actors in the healthcare system, and so they can't be doing those things for all those types of actors as well. Paul Tucker talks about information agencies that produce information and give independent advice. So one could envisage a largely independent information and pandemic planning agency that could be formed from key sections within a public health agency. It could either operate as a standalone agency with its own legislation, or as an sub-agency within a public health agency, but with part of the legislation governing the public health agency giving specific powers to this sub-agency and giving them particular things that they need to accomplish. Now, this agency or sub-agency should largely cover health, but it should also be responsible for testing plans that get into fiscal matters. And it should also be sure that it's always looking at not just health, but also at social, economic, and financial matters. The other type of agency that's needed is one to evaluate the implementation of plans and the updating of those plans. An ongoing evaluation role should include evaluating the following things. First, implementation of the official pandemic preparation plan. Secondly, the incorporation of recommendations from postmortems, as well as the stress tests and exercises that I'm going to be talking about in part 3. The updating of the plans to incorporate new scientific and medical findings, and the training of ministers and senior staff regarding the content of the plan. Now, there's 2 models here for the evaluation agency. Could be an independent standalone agency, or it could be given a role that's given to the existing Auditor General. Because in many democracies, the Auditors General play an evaluation role that is seen to be very valuable, it's probably the most likely choice in most countries. But in either model, it would be important for legislation to clearly spell out the evaluation role in pandemic plan that is to be played and how often things are to be done. It's important to consider the role of the legislature and its committees as well. Reports by the evaluation agency, such as the Auditor General, need to be reviewed by a legislative committee to ensure accountability of the information and pandemic planning agency and the government itself. The government and the legislature also need to ensure that emergency powers legislation allows scope for public health decrees, lockdowns, and I should add as well, the need to be able to command the use of resources if resources are needed to do such things as to produce personal protective equipment or vaccines. There are a number of governance challenges, which often include bureaucratic and political implements, such as groupthink, such as bureaucratic inertia, such as ignoring or downplaying low frequency, high cost events, and such as deliberate bureaucratic and political obfuscation, not explaining uncertainty ex ante, for example. So with clear plans, a clear role for agencies, a clear role for the legislature and the government, one can reduce the failure to meet the above challenges. So in terms of postmortems and planning, some final comments on them. Policies decisions during pandemics are undertaken under much uncertainty, but better preparation in terms of plans and their implementation would have reduced the consequences of that uncertainty and made it possible for the government and health authorities to act more rapidly. Government backstopped private catastrophe risk insurance would reduce many uncertainties on the economic side and replace the need for some government programs. It would draw on the insurance industry's own personnel and databases, and be much more efficient than getting the government involved in direct insurance and direct grants to corporations and other firms. Good governance with appropriately independent agencies can increase the probability that pandemic preparation can be well done. Good postmortems and plans are prerequisites for good stress tests and exercises, which we'll now turn to in part 3. So we propose using the postmortems and new plans that I've just talked about to create stress tests and run exercises, also known as war games, incorporating health, economic, financial, and fiscal strategies. A stress test using models and scenarios is applied to a system to see how it responds in a severely adverse environment. In contrast, an exercise or war game is a real-time exercise for decision makers to see how they respond to such environment as shocks are fed in over time. Now, there had been a number of reports and exercises done before COVID. A good example is the 2006 Ontario SARS Commission report. It concluded that the Ontario health system was underfunded and unprepared for a pandemic. It made a number of recommendations, including many that look carefully at preparedness and equipment in organizations and funding. Now, there was a postmortem of this postmortem done by the Royal Society of Canada in 2020, and it concluded that the recommendations of the SARS Commission were by and large ignored. Now, there were a number of other reports pre-COVID. that talked about plans and what needed to be done. And unfortunately, not enough was done. In fact, little was done in most pre-COVID reports to either use or recommend exercises to influence pandemic policy and an organizational structure, or to prepare senior policymakers in the pandemic area. So let's now talk a little bit about stress tests, their history, and their methods. Stress tests originated with the engineering stress tests of structures and materials. My father was a civil engineer who did research in a number of materials, including, importantly, glue laminated timber and masonry. And he worked in a lab where there were machines that would put stresses on these types of materials and push hard until they broke. So that's how engineering stress tests worked. Now, subsequently, in the financial area, banks started to do stress testing of their assets and liabilities, their balance sheet, with a financial and economic scenario. That was required by regulators, and originally all these stress tests were done by the banks alone, but the regulators became more and more involved in the way that the banks were doing them, and sometimes used their own models to stress test the banks. So how should we get ready to do pandemic stress tests? Well, first of all, they should build upon the tests that were done prior to COVID-19 with updates based on the postmortems that have been done subsequently. They need to draw on personnel from relevant government departments and health areas, as well as outside experts. And a test drawn up by an expert group should stress health, social, and economic consequences of scenarios that are plausible, but really quite extreme. These scenarios should fundamentally differ from the recent past, because the ones that were, or at least the recent past, should have been covered well in the postmortem of that period. The entire test should be revealed at once, with officials given sufficient time, a week or 2 or 3, to work through all the implications of the stress in some detail. The weaknesses of current plans should be noted with recommendations. The test should be run at the national, provincial, and local levels, and maybe one could envisage a cascading stress test where the test is done first at the national level, and the response of the national level plus the stress test then is passed on to the provincial level and subsequently to the local level. There should probably also be periodic international tests created by international bodies such as the World Health Organization, the International Monetary Fund, and the World Bank that would look for weaknesses in cooperation and would raise questions about cross-border issues. So let's look a little bit about the history and methods of exercises or war games. They did originate with war games that were carried out by the military. First of all, there were tabletop war games, for which the civilian versions are chess, diplomacy, and risk. Then there were field exercises with real troops and equipment. And finally, large-scale strategic games, often using computer simulations. Corporations picked up on this, and their games incorporate strategic scenarios. Their games go far beyond mathematical predictive models by incorporating professional judgment from senior people in the similar kinds of corporations. And these games should incorporate plausible worst-case scenarios. Now, governments faced with questions about policy have started to pick up on the types of board games used by the military and corporations. And they use them to deal with situations where there are multiple institutions involved in the context of emergencies. Low probability, high cost events are the typical focus. And detailed forensic reports from previous crises in the similar areas are used as guides to construction of the war game. So how should pandemic exercises be prepared? We would suggest that the group that's used to construct stress tests could also be used here. Games should include scenarios exploring the budgetary and social consequences of different policies. Information and shocks or surprises are slowly fed into the participants in this exercise over the full course of the 2 to 3 day period that the exercise lasts. And these participants should be the senior people, the policymakers that are involved in pandemics. The game should include communication function players to communicate the latest information on the virus and evolving policies, making clear that policies will be contingent on updated information. In other words, the game has to include the construction or the putting together of the appropriate communications as a test to whether one is prepared to do that in real time. The game should also incorporate scenarios where errors occur because of surprises, so that players will be exposed to the consequences of possible dissembling, implying declines in public trust. So what happens to the results? The results of both stress tests and exercises should be summarized by our group independent of the participants, but including some of the creators of the tests and exercises. The results should be analyzed and acted upon to correct weaknesses in pandemic plans, to change organizational structures and procedures, and so on. Within a year, the plan should be checked, probably by the evaluation agency, to see if they had incorporated by that time what was learned in the stress tests and exercises. Exercises need to be carried out regularly to test new systems and technologies for their resilience under stress. New risks and uncertainties appear periodically, and they should be included in subsequent exercises. Now, it's important to note that learning how to work together on the part of the senior advisors and the policymakers is an important part of any pandemic exercise. Let's talk a little bit about training for exercises. Currently, many policy economists are unprepared for the type of analysis coming from stress testing and exercises or wargaming. You understand sophisticated strategic wargaming methods that are used by corporate and military analysts and the stress testing used in finance. Similarly, many in the health establishment have only a rudimentary training on appropriate economics, finance, and systemic risk management. The latter is seen as being highly specialized for financial institutions and the regulators, and not relevant for many other social areas. And of course, this is incorrect. So one needs to address weaknesses by requiring appropriate courses and training, and this should be thought of as a serious prerequisite for senior public services servants, policy staff, and policy makers in the pandemic area. We need to move away from specialist silos when thinking about pandemics and bring social, economic, and financial costs into the discussion. So to conclude my presentation, the pandemic revealed serious deficiencies in public health and government preparations that let deaths and costs get out of hand. There are disturbing similarities with bungled preparations for the global financial crisis. We propose sophisticated postmortems and analyzing policy successes and failures around the world and leading to new pandemic plans. these postmortems will need to address major governance issues, including clarity, transparency, and accountability. We also propose the regular use of major pandemic stress tests and exercises. A major benefit of this approach is that it requires a system-wide analysis of a pandemic with health, economic, and social content. And this is similar to what we would propose for any other catastrophic risk. For example, major earthquakes, floods, or cyber attack. Now, anything that is low probability, high impact event is probably one of those things where this type of approach can be used. I'm interested in your questions and whether you think that any of the techniques that are used here would be useful in some of the areas that you yourselves are researching. So thank you for your attention, and let's turn to questions and answers.
Thank you very much, David. The presentation has been a very broad brushstroke, a very methodical look at some of the issues that are involved. Generally, when the person who chairs it, they get the right to ask the first question. And so I want to do that, but I want to tee up the first question I saw from others was Claude. So Claude followed by Michael. But my question is to ask, in addition to the kind of systematic testing and stress testing that you've been suggesting, it seems to me that any pandemic is going to affect certain parts of the population very seriously. So in most pandemics, you would find, for example, seniors in homes. We saw a great deal of death and suffering in Ontario and in many countries among the ill and infirm, for example, and particularly in those homes. So I'm wondering if there's not, a handful of things that are glaringly obvious that require recommendations to do them before one looks at the huge panoply of possible actions that could take place. So for example, you said yourself that health workers that were coming from one home for the elderly to another home were transporters of disease. But we know that the reason that they're doing that was often related to part-time jobs and low wages. And so if we know that there's a very vulnerable sector, should we not think about taking actions apart from the widespread larger testing to deal with 4 or 5 key things that could be done to give protection right away to certain more vulnerable sectors? And I haven't mentioned the indigenous or populations of color, but I just wanted to ask that question, focusing, for example, on seniors and the pay and the security of some of those lower paid healthcare workers. Seems to me that doesn't need to wait for a broad set of studies.
Right. I think there's a good deal of truth in what you said, David. And I think it's because in the particular example that you use of long-term care homes, it's because the same kind of thing can happen in the seasonal flu situation. And therefore, it's an ongoing thing. And therefore, the benefits of doing what you said are ongoing, and they're not just once and for all kind of things. I would point out that the other major pandemic that we've had in the last 125 years was the Spanish flu, which really did not affect older people very much at all. It was the younger people that were involved. And so when you're talking about specific groups, you have to be a bit careful because it's not always clear that it's the same ones that are going to be hit as the last time around. But picking up on your general point, are there some overarching things that we should be doing? I think one of those overarching things is looking at the stresses there are in the healthcare system overall. As I said when I was discussing the 2006 Ontario SARS report, it had picked up on the fact that the overall health system in Ontario was stressed, and therefore there was no excess capacity. And that was going to be a major problem when a pandemic came along. And that's exactly what we've heard happen. And so I think there are many reasons why we need to deal with the stresses there are in the healthcare system, and pandemics is one of those.
Thanks, David, for that. Let's move on to Claude, and then following that, I'll call on Michael. Claude?
Thank you very much, David. A very thought-provoking presentation, so much so that your book is now on my phone and in my reading queue. My question actually is more of an invitation for you to extrapolate these connections and your very cogent list of things. Basically, it's how to analyze an overwhelming disaster. And I would like you to extrapolate this and see whether or not you think this could be useful to the management of the great unraveling, as it's sometimes referred to. It used to be referred to as a collapse, but the indications are things won't collapse like an avalanche. Rather, they will come unraveled, and some aspects of society will continue to function while others cease. And so do you think that this methodology that you have and this laundry list of 10 items in particular would be useful as a starting point for to take a look at if we can't avoid an unraveling, how do we manage it to minimize human suffering?
I'm sorry, I'm not clear on the use of the term unraveling.
Well, this is the Club of Rome. So 50 years ago, we saw the wisdom, we collectively, obviously, a lot of us weren't here, we saw the wisdom of that you can't keep doubling every 30 years before something reaches a capacity. And the models, the best computers and the best software at MIT back in the late 60s, early 70s said that you won't hit an asymptote and stop growing. You will actually collapse because you have overshot. And so the other book that I'll refer to is The Overshoot, which explains all of this in detail. And it just feels like we're on the scenario, if I can mix a few other concepts, of too little, too late. We're doing a lot of things. We're making improvements, 30% renewables in the electrical generation, but yet overall energy is still hydrocarbon based. And that's why every year we set a new record on how much hydrocarbons we extract and burn and put up into the atmosphere. So the heat blanket continues to thicken even as we wring our hands and gnash our teeth. And for many of us, sometimes called doomers, but doomer is actually a starting point. It's like, what do we do about this now? So if you're with me this far, David, okay, assume that things will end very badly for civilization. How do we manage it? You have actually come up with a list of 10 things that have applied to somewhat different, and that's the extraordinary thing, economics versus healthcare, and yet they have a commonality that you have discovered. How can you apply that to what many of us feel are inevitable unraveling management that will be required?
So I need to first start with kind of a comparison. In some sense, the underlying story of what's happening with the buildup of carbon dioxide in the atmosphere and the depletion of resources are to a large extent the trends are predictable. In other words, they are the opposite of low cost, high impact, low frequency, high impact events. So the analysis that I've done doesn't carry over immediately. However, what we are seeing is that they are becoming associated with one-off events that are low frequency but high impact. So there are things like forest fires and floods and so on. So we can predict that there are going to be more and that the frequency is higher, but still any one individual thing that hits is one of these high impact things, and it was unpredictable exactly where it was going to happen. So I think that part of it can carry over, and you can kind of use some of this analysis in dealing with that aspect of what is going on in the world today.
Okay, thank you.
John Legge, I'm going to call on you after Michael Gilbertson, but right now over to you, Michael.
Thank you, and thank you, David, for your presentation. That was really fascinating. I'll read my question. I gave a CACOR talk on February the 21st, and it was concerning the epidemics and the pandemics of diseases and conditions which are caused by endocrine disrupting chemicals. And these annually cost $340 billion in the United States. Public Health Agency of Canada does not even recognize these pandemics and has no competence in this area, and the governments are completely disconnected from the issue. How can we get governments to respond to the copious epidemiological, mechanistic, and toxicological evidence? And my second question is it useful to look at the political ideologies that inform ministers and governments?
So on the first one, I guess there's, is there any concern that the health agency has been overtaken by people that are representing certain manufacturers of things that lead to this? I mean, is there a need for more independence? I don't know. I'm not an expert in this area, but is there a need for more independence so that there's less political pressure not to look at something?
I think that's exactly right. I think what has happened and what we've been very aware of for several decades now is that the corporations have really captured a large part of the health protection within this country, within the provinces, and in other countries as well. And essentially, information on endocrine disrupting chemicals and the extent of the epidemics and pandemics which have been occurring have been silenced. And governments are just simply unwilling to acknowledge the sheer scale of what is going on. And I'd suggest that these are what you define as low probability events that have in fact had extraordinarily high impacts on populations.
Yeah, so I guess that then the first question is, should we be demanding a more independent public health authority and to look at all these kinds of things? Because I think that's where it would start. Can you remind me of your second question, please?
Well, it's really essentially about the political ideologies. You talked about the social, economic, and financial, but you seem to shy away from the political ideologies that inform ministers and departments.
So on I mean, one needs to take that into account, I guess, but I was really thinking about standing back and what would be seen as a role by an independent observer or an appropriate public servant in looking at a situation. And that's why I did not throw political in. And indeed, the argument for independent agencies is actually to get short-run politics out of the equation.
Thank you.
And thank you, Michael, for your question. Switch off your video and mic,
Yeah.
and that would be good. And John Legge, I'll recognize you, and then Art Hunter, you have a comment or question following John Legge. So over to you, John.
Thank you, David. Can you hear me?
Yes.
Okay, good. David, I was fascinated by your concentration on the insurance sector, and it certainly is very important when you're considering how pandemics can be prepared for. But my question is, how can we ensure that our government does some of the planning you recommend? That is to say, one gets the impression, and maybe it's simply an outside of government feeling, but one gets the impression that a lot of the focus is on the latest issue to do an investigation, etc. Now, I know that a lot more goes on than what is in the media, but the planning is all well and good. How can you actually recommend that this is pushed into the agenda so that it actually happens?
Well, I'm not a political scientist, and so I'm not sure that I have any easy answers to that one. I guess as individual citizens and as non-government organizations, one needs to make the argument that citizens would be better served if certain types of planning were put into place.
Okay, so in other words, concentrate on pressure from the public because of the soundness, in my view at least, the soundness of the ideas you put forward.
I guess that's what I'm arguing, yes.
Yeah, okay. Right. Thank you very much, David.
And thanks, John. You'll mute your mic, will you now, John, and turn off the video? And I'll call on Art, and following that, Tom Doherty, better known to most of us as Dave Doherty. Dave, you'll be up following Art. So over to you, Art.
I'm going to change my question because people have asked it in multiple ways, and my concern now has elevated considerably because I'm now at the point of saying I just do not trust my government to really do anything substantive. They're not putting the resources in and don't seem to be taking it seriously. Therefore, I then turn and look at myself and say, what can I do for myself, for my family, for my community? Government is not likely to do it. I don't trust them. What should I be doing? And one of the things perhaps I should let you know that from the last pandemic, I went off and put in ultraviolet band C into my furnace, and I have air filters and using ultraviolet band C to that disassembles the RNA molecule from COVID-19. As a matter of fact, it does it for all viruses, all bacteria, and all molds. And that was because I didn't trust my government then, and I trust my government now even less, based on your talk. Thank you, by the way. I'm delighted that you brought all these issues up. but can you address things that people could be doing themselves in planning and ensuring their own survival the next pandemic, as well as things they can do at the community level?
Well, unfortunately, I think those things are very, very different than the kinds of things that we can ask our governments to do. So I'm not sure that I'm the one who's best well placed to give you ideas, but so I really don't have any comments.
Okay, thank you.
John Hollins, if you can be on deck after we hear a question and comment. I think Dave or Tom Doherty has 2 questions. So you're up now, and then followed by John Hollins.
Thank you, Davids. And the reason I'm using Tom is because that's one of my names, and there's a lot of confusion with so many of us around as Davids. So my first question is this: how does pandemic planning compare to planning for the societal collapse that may well be approaching as climate change becomes fierce and biodiversity loss intensifies?
I think my answer there is similar to one of the answers that I gave before, is that there, at the first instance, they're very different, because we know things are going to get worse, at least for a while, no matter what we do on the climate side, and therefore the kinds of things that I'm looking at, which are dealing with low probability, high impact events, are only relevant because we think that as things get worse in the atmosphere, we're going to have more of these low frequency, high impact events happening. Some of what I've talked about are relevant because we're going to have, as I said earlier, more forest fires and more floods, but they're really not relevant for what we should do to deal, with the fact that climate change is getting worse overall and temperatures are rising and so on. There are certain things that are predictable, and my analysis really doesn't deal with the things that are predictable. It deals with the things that are unpredictable to some degree.
Okay, let me see if I can.
Question.
Let me see if I can focus for a moment before I get to that second question on one aspect of the changes that we're bringing about at the moment, which may well be closer to what you're seeing with pandemics. And that is the idea, a possibility, that there could well be a famine.
I'm sorry.
Here. There could well be a famine here. So how would you say our preparation for dealing with a famine compares to what we've been trying to do to prepare for a pandemic?
I think the assumption has been made that we could always import from elsewhere. And that's kind of the underlying planning assumption. If we thought that was not a good planning assumption, then we should be storing up.
Yeah. Well, I would argue that it's a terrifying situation that we would make that presumption, because we could well get a famine at the same time as we have a pandemic, and we may well be told by people from whom we could import food, you can't have any.
Mhm.
Yeah, I used to work in this area, by the way, and I came to the same conclusion. I was working for Health Canada at the time, that we were completely unprepared for, at the time, we were specifically trying to look for a flu pandemic. And in fact, SARS-2 is very similar to flu in many respects. Different virus, that's true. And yeah, I came to the conclusion we're completely unprepared. And as it turned out, I would say we proved it. My second question is this one. Was poor communication to the populace of what would be done when a pandemic hits the worst failure of public health authorities during the SARS-2 pandemic?
I'm afraid that my recollection of SARS-2, sorry.
Well, okay, so SARS-1, you mentioned earlier that you had been involved in studying what happened during that in a retrospective study. The thing that caused COVID-19 was a virus, which is appropriately called SARS-2. It was a SARS virus. It's the second one we've encountered. So I think it's appropriately labeled SARS-2, and the history books eventually will call it that. So I would venture that the worst thing that happened in the pandemic was people didn't know what to expect, and they reacted really badly.
I think there were some bad things about communication. I mean, I can point out to two. One was the stay-at-home mantra of what one should do that was used in many jurisdictions, and actually, it was poor advice because actually people would have been much better off if they had gone outside and just stayed 2 meters away from people. The effects on mental health were exacerbated by telling people that they should just stay at home. The second thing is that initially there was a lot of emphasis on surfaces, and that the spreading of the disease was thought to be, at least in part, because of touching surfaces that other people had touched. It turned out not to be the case, and specialists knew that within months of the start of lockdowns, and yet there was really never adequate communication to people that that this is airborne spread, and that you should focus much more on that way of spreading rather than on washing your hands. So those are two examples, I think, of where the messaging in the first instance should have been not used at all. In the second case, when we learn more, it should have been communicated to people what we indeed had learned.
Indeed. Okay, thank
I
you.
think, Tom, we'll leave it there until the more open discussion after the recording is finished. But I'd like to recognize John Hollins now, but Anitra, if you're still with us, you had a comment or question, so you'd be up next following John Hollins. Over to you, John.
Thank you, David. Thank you, David Longworth, as well, for your compelling analysis and comprehensive treatment of your subject matter. I'd like to just introduce a somewhat parallel observation from my domain of professional experience, and which continues into retirement, as I think yours evidently does as well. I worked at the Department of Environment for the second part of my career. Between the Montreal Protocol, where Canada was politically a leader with other countries at the ministerial level, that was 1980. That was during the 1980s. It was signed in 1988. And the Kyoto Protocol, not that much longer later, just 1992, something changed. The role of expertise in the decision-making of government changed substantially. There was a report last week that showed that Canada is failing to hit its own targets that it set under the United Nations Framework Convention on Climate Change. So has there been a sea change in all aspects of the work of the Government of Canada, where in the Montreal Protocol, the work was led by a senior bureaucrat? All the negotiation and even the signing involved the leading expert in the subject area. By the time we got to Kyoto, that was still there to a degree, but it was lost very quickly thereafter. So is there a root problem from what you have studied and told us about, perhaps throughout the Government of Canada, and is there any way forward?
I mean, I only have anecdotal evidence, and some things that have concerned me that I've seen over the last 30 years. I mean, none of this has any deep analysis to back it up, but I know at one point the government wanted to make sure that people had a wide variety of background, a wide variety of experiences as they moved up from, you know, people who were senior analysts to become assistant deputy ministers, to become deputy ministers. And one of the outcomes was then you had fewer people with deep knowledge of the area when they became an assistant deputy minister or a deputy minister. And in particular areas, like the health area, that was a huge disadvantage because it was senior bureaucrats in the health department that got rid of the network in May 2019 that was reporting on what was being heard around the world. They were doing the deep intelligence of what was happening with respect to potential pandemics in all the countries of the world. So it was some bureaucrat who had no background at all in pandemics who made that decision. And so when the emphasis becomes all on short run, the government needs to save money. Oh, that hasn't had a high payoff this year, so let's get rid of it. I mean, that thinking is very short-sighted. I mean, it's another example of recency bias that I talked about that Mark Carney had mentioned. So I think that unfortunately there are a number of places within the government that people with deep expertise and deep expertise also with policy in that area. So they're not just scientists, but they understand that, you know, different policies would have different effects on what they're examining. I think that there unfortunately are not enough people that have that deep expertise and the deep expertise that can be used by people interested in policy. That's really harmed our government and how it acts. And I think as well that the inserting so many people from the political side in under a political chief of staff in government departments has also had an impact that hasn't been positive in terms of getting the best policy for normal citizens, ordinary citizens.
Thank you.
I think we'll take just two more questions, one from Anitra, and then I inadvertently overlooked Jean Doherty, our recent past chair. Sorry about that, Jean. So I'll tee you up just following Anitra's question or comment. Thank you.
Thank you, Dr. Longworth, for a very cogent explanation from your viewpoint of what happened. I think more people should be taking this massive amount of data when the world stood still for a single event and analyzing it from their own disciplinary viewpoint, because I think we could put that together. I think the Club of Rome in general has completely lost an opportunity to show their analytical skills. I'm in the United States and was in the United States during the pandemic. And of course, one of the big differences between Canada and the United States is we didn't have the wealth, the national wealth, to support everybody. So everybody tried to go to work, or at least those who were essential workers, which was a very broad category, went to work. But certain unions, such as the school teachers union, basically shut down the schools so that the students were from a school which had distance learning were able to learn, and the rest of them did not have any kind of educational input during that period of time. And this leaves us with a whole several year class of students who live behind masks, who didn't go outside to play, and who are way behind in their reading, writing, and arithmetic, so to speak, which is of great concern. I think the question is what to do with young people versus the old people who we know have a weakened immune system. As you proceed after 60 years old, your immune system goes way down. That's one of the questions to be teased out of the data and see whether there's any actuarial kind of solution there. And the young people perhaps should be left to play. But the second question is, did you do any separation of the cohorts of the pandemic in terms of ethnicity, which we all know some people have a more vibrant immune system, or dietary, or young old, or young and very old, et cetera, et cetera? Were there in your variables?
So I have not studied either of these questions on my own, but other people certainly have. And I know that the whole question of what should have been done with closing schools or not closing schools is one where it seems that the evidence is that those jurisdictions that decided to close schools for the longest period of time did exactly the wrong thing, and that it had effects not only on education, but also on the socialization of particularly teenagers, I believe. So there were major mistakes made, and you can see the evidence across provinces, across states in the United States, and across countries. I'm involved a lot with refugees, and I know that a lot of refugees from Africa were in camps in Uganda, and Uganda, unfortunately, was one of the countries in the world that closed down its schools for the longest period of time. And that was very, very harmful, not only to its own citizens, but to those people who would eventually leave Uganda to go elsewhere, to come to Canada, for example. So yes, there were very bad mistakes made on the education side, and they are going to have impacts, which people, I believe there are some researchers who are, planning to measure this. So what's going to happen to the earnings of the people in the cohorts that were hurt the worst relative to the cohorts that came before and after them, because of what happened to their poor education over the course of that period. Now, with respect to groups that often are disadvantaged, like Black, Indigenous, and people of color, there have been studies done in Britain, I know, and elsewhere, although I've not been following that literature too closely. But it's kind of as expected, those disadvantaged groups suffered more. They were infected more often. They died more often than people in the same age cohort of people who were not in the disadvantaged groups. So yes, there was a major problem. And we know that part of the reason for that is that because a number of those people in racialized groups tend to be poorer, they tend to work in workplaces where people are closer together, and therefore the disease spreads more easily.
Thank you.
Welcome.
Jean, the last question of the day to you, and then following that, Ted, if you're available as our president to thank David, that would be great. Over to you, Jean.
Thank you. And thank you, David, for an absolutely fascinating presentation today. I'd never considered comparing the financial crisis to the pandemic. And it really stimulated a few thoughts in my mind. I had originally asked a question that I think you partially addressed. But the one aspect that I'd like to ask you about is that you had pointed out that the Ontario government's analysis of the SARS-1 crisis didn't last for, they did the analysis, but people didn't really pay attention for too long. And the thing about the pandemic is that it involves multiple levels of government and multiple groups that have to be coordinated properly. Whereas I suspect that with respect to the financial crisis, you're dealing primarily with the federal level of government, not exclusively, but they have the most control on it. Whereas that's not the case when it comes to health and pandemics and so on. So you have to work together. So how do you suggest that we get government organizations who are looking at these things over multiple government timeframes, election cycles and so on? How do we get them to pay attention to what is going on, and how do we get them to work within multiple levels of government, federally, provincially, municipally? How do we get them to work together on something like this? It's critical.
Yeah, well, I guess the federal government has to take the lead here because so many of the policies are its. But then one needs to also rely on provincial governments and on provincial governments which have certain control over what happens regionally and locally. It's a difficult thing. Again, it's, people are less now focused on the pandemic. And I think it was a major problem that we didn't get the postmortems done earlier, because the further we are removed from when the pandemic started, the less it's a priority for people to say at the next election, well, I think it's important that you have a proper pandemic plan at the provincial level, at the federal level. So yes, it's also a part of those three behavioral things that Mark Carney talked about. They apply not only to governments, but they apply to you and me as citizens when we think about, well, who are we going to vote for, or what do we want to raise as questions when we go to the all candidates meeting next time. Yeah.
Thank you. Yeah, very nice.
Ted, could you say a word of appreciation, please?
Oh, certainly. David, you're raising very interesting questions for us. Just to give you one little comment before I go on to the sort of formal thinking. Governments are worse than almost anything else when it comes to the future. It really does not figure into any of their aspirations. It's been many years since the Canadian government had an effective mechanism to really address futures and forecasting. They had an interdepartmental committee on futures and forecasting who actually got to talk directly to the decision makers. And I was fortunate to be in that for a while before they dissolved it, because they just didn't feel it was relevant to the new people that they'd put in. who were there to be a manager's manager. And little things like data, information, or intelligence had absolutely nothing to do with the criteria that they were there for. The term I came up with was called the vertical whisper circle, where you have 8 people between the one who knows something and the one who actually gets to make the decision. And therefore, what gets to the other end is very seldom what came in the first place. Is that a cynical view? Yes. Was I there watching it? Yes. So really the look you have given at this very particular one is very relevant. It's relevant now. The governments are struggling with anything having to do with the future. They never did well, and they're doing even less now. And the worst one in my mind is when you farm it out to a particularly vested interest like the Fraser Institute. It'll give you an answer before you even ask the question. So that said, thank you very much for raising this very interesting presentation. You can always tell from the caliber of the questions people ask that they liked it and they stuck around, and they did. So thank you again for coming. And hopefully we can have you back again with better news the next time. Now, just to give you the commercial, yes, we do like you to belong to the club, the Canadian Association, the Club of Rome. We get the money that allows us to put these on every week and to attract very interesting people each time. So please visit http://canadiancore.com. Our website shows you what's coming up next, shows you a lot of information from our members on what they think is important and useful. We would also say that this will come on the YouTube within the next day or so you can watch it and share it with friends. And when you're on the YouTube, please subscribe. It lets us understand how many people are watching and what really makes a difference. So thank you again. And now we can turn off the video and let you have